For Emele so say ye din komo ehu hia pa ne eye benada se ne canon is healthy Tuesday na ye din komo fa nia yesusu sebeboa na aboa me aboa ye nyina mapomudin SCP esita ene ye di yahra wa ehu enkomo broni e friend lungs na yeti aye anopa ye nya Dr. Emele Arthur-Hayford a oni yen ebabidin komo afa yahra wa anase ye lungs ho Dr. Kwaba now what then?
Yamina dum bibi aboko.
Na yeda nyame ase do de yabe do wa be kan yensa na ebe kan fante kakra na yeze brofo kakra afem was infant for ye pa brofo sem but ye bebo modi and ebe kan fante no krojin as much as we can so ye kan ahrawa ana lungs describe chire yen kakra.
Okay, nti ye ka lungs anatomically no or ye why there sac e bien ehun
Kotokwen.
There's just like two heavy sacs in the body. Now, if you take your body, the diaphragm separates your lungs from your abdomen area, and because they are two, they lie on the left and the right side. So these are also separated. You can use your sternum to separate them. And so left lung, right lung, and then the diaphragm separated from your abdomen. Now lungs, they are connected to our nostrils and our mouth. From your nostrils and your mouth, you have what we call the windpipe or the trachea. So the trachea goes down and then breaks into two or branches into two. So you get two bronchi.
Okay.
Now these two bronchi is like a tree, in your branches. So the bronchi would now have to break down into a more smaller branches, if you want to call it, called the bronchioles. Now these bronchioles will also break down further into the tiny parts where the real work is done, where we call them the alveoli or the air sacs, those tiny areas. So that is how the lung is. Now lungs our connection with heart, now nostrils. Whatever
connection
goes
with on.
Yeah.
Now is that what we can see there?
Right, so that's the bronchiole and then the alveoli being displayed over there.
Okay, so now that you've described or your chest, the chest cavity. Okay, I describe what is the real work of the lungs?
Okay, so when you take in breath or when you breathe in, what actually happens is that you are going to take oxygen in its raw form. And when the oxygen goes into your body, it's the duty of your lungs to now help move it from the air into the bloodstream, so that now blood would move to all parts of your body and then deliver those oxygen. This same lung is responsible for taking out carbon dioxide. So as human beings, we inhale oxygen and exhale carbon dioxide. So it's the responsibility of the lung to help the tissues in your body, the body organs, from the crown of your head to your toes to get oxygen. All of these things depends on the lung. So you can actually say that if we take your lung out and we take your heart out, you don't have anybody again, you are gone. Because all the tissues depend on oxygen. And it's this lung that makes the oxygen available. If you come to the other side, exhalation, the lung is supposed to help you get rid of the carbon dioxide that is produced after you've utilized the oxygen and the body has gone through its own metabolic processes. When this carbon dioxide accumulates in your body, it has its own effects that it can come with. So the lungs help you to now exhale those things from the same parts that we are talking about, either through your nostrils or your mouth. So that's the crucial role of the lung in the body.
Lungs. Okay, so we've seen, like you just mentioned, without the lungs and the heart, you are nobody.
Yeah.
Because every part of the body depends on oxygen. They need it. And so if the lungs are not working, if the heart is not working, you are in trouble. But here we're concentrating on the lungs. So what damages the lung?
So the lung can be damaged by a lot of things, all right? You can look at infections as one of the things that can actually affect your lung. That's where you talk about the pneumonias, COVID-19, all of those things. They can have an effect on your lungs. There are other environmental things like air pollution. Then the main leading cause is smoking, of course. So smoking, environmental issues like pollution, and then infections. These three main things could be the major ones.
So let's break them down. Let's start with the infections.
Okay.
You've talked about pneumonia, bronchitis.
Yeah, bronchitis.
And then the rest. So let's look at these infections. How do they affect our lungs, and how do we even get it in the first place?
Okay. So you can look at things like let's pick a very common cause of pneumonia, which is caused by a bacteria called Staphylococcus pneumonia. Now, when you get infected with this bacteria by probably inhalation of this from the environment, or usually you hear people say that when you sleep under the fan, you get pneumonia.
Yeah.
The pneumonia is already coming from the fan that is going into you, but the possibility of this particular thing being transmitted into your lungs, probably from a dirty environment and all of those things.
Let's dwell there, because we need to help somebody. We've heard that when you sleep under the fan, you might get pneumonia, or if you expose yourself to cold. And you're saying that, well, the fan might actually be dirty, containing all that bacteria. So it isn't the fan per se, but the dirt.
Yes.
Is that what you are saying?
Yes. So
Okay.
it exposes you to these things. Now, the fan is just, let's say, making the thing that will cause the issue more available. let's put it that way. So a lot of air is now going into the lungs, and remember, the fan is just trying to get circulation in the same room. So anything in the room is what is going into your lungs. So some of these things, you can get some of these infections actually through all of that. Now, when it goes into your lungs and you get the infections, what happens is those tiny sacs, they can, as a result of infection and inflammation, be filled with fluids. Now, when they are filled with fluids, that's what makes breathing difficult and all of those things. Ideally, they are supposed to be empty. What goes in there is air, air and nothing else. But because of the infection, you can have fluid buildup as a result of inflammation and all of those things. So that's how infection can cause issues to your lung as well. Now, if we come to, so we're speaking about infections. The other ones that we can talk about is the air pollutants or air pollution and all of those things. Now, these air pollutions, for instance, from cars, the fumes from cars, for instance, what they usually contain is what they call carbon monoxide. So you inhale carbon monoxide into your body, and it will give you a lot of issues. If I'm to just go into details, the red blood cells in our blood, which is responsible for transporting this oxygen that your lung is trying to make available to the body, the carbon dioxide can compete with oxygen and bind to them. Now, when they do that, it means that oxygen is no longer being transported, but you are having carbon monoxide, being transported, which can give you issues. Yeah, so that's like fumes from cars. Some of these ones too, they have tiny things that you can't see with your eyes. But remember, so long as you are breathing them in, they are going to be deposited in some of these air sacs, and with time can give you very serious effects. So infections, I've spoken also about the air pollutants. Then the major cause of lung damage is the smoking. You know what happens is that when you smoke, the what we call nicotine is a component of some things that people smoke in, and nicotine makes you addictive. So you like the feeling, and with time you can't get yourself going. Yeah, you always want to. You always want to get. That's how come people smoke and they struggle to quit smoking. So you ask yourself, this man is just inhaling smoke. Doesn't he get tired? It's not his fault. With time, he's gotten used to that good feeling that he gets when he has nicotine build up in his body. Now, aside nicotine, this carbon monoxide I'm saying, you can get some of those things when you smoke. So people that smoke tend to have a lot of issues, right? From the fact that it can lead to lipids accumulation, and eventually even becoming a risk factor for type 2 diabetes. It can cause the buildup of lipids in the vessels that blood is supposed to flow through, and you eventually some of them begin to have heart problems. To some extent even leads to stroke, because oxygen is not going because of this carbon monoxide. the blood has to overwork so they can get some heart attacks and all of those things. So these are the major things and how they damage our liver.
Our lungs.
Our lungs, sorry.
All right. And so, Doctor, you've mentioned pollution, air pollution, you've mentioned infections, you've mentioned smoking. Let's come home. We have certain fumes, the things we work with, and fumes coming out of there, like the parazone, mosquito coil, and stuff, domestic stuff we use. Recently, we heard about naphthalene balls and all of that. So domestically, you mentioned fan earlier. We've heard about that. So let's look at those things. Parazone we use, naphthalene balls, mosquito coil, and all of that, and how they affect our lungs.
Let me add that some of these environmental things I'm saying are also work related.
Okay.
So over time, some people did a research and they proposed that asbestos. So if you recall, in our homes, these plates, ceilings, it's not the roofing like the metal one. Those breakable ones.
Yes, the breakable ones.
So there's a component in there called asbestos that people actually propose that can cause damage to lungs with long exposure. So if you're someone working in production of some of these things outside your home, you can also be infected. So I'm just trying to...
Doc, let's educate properly, because you've mentioned something. Somebody may not have understood it the way you want. So we have the aluminium roofing sheets.
Yeah.
And then we have the old type now. And we're for more now pie. I know who say tiles, but and said that tiles, papa. Now we can say no. Say that will be done so. Obet me enya chemical be omu a ohumi a ebetumi a damage the lungs.
So the issue is when the research was being done, the focus was not really on the consumption, and when I say consumption, and using it in your homes, but the production of the entire thing. Yeah. So when this thing is exposed to extreme heat, it's believed that it gives off some of these chemicals and all of those things. So at the point, people were advocating that you take off all those things and start using the new roofing sheets and some of these. So those are some things that in our homes you can have issues with. Aside that, you know, growing up, our parents used to put together some things to set up fire. Like they can go and pick this polythene bag and all of those things. Yeah,
polythene bags. And how about methane, the one we call the byproducts from the palm nut?
Right.
Those ones, papers.
Yes.
And
so
kerosene.
The issue is that when these things are being used, the air becomes polluted. Remember, combustion, when there is burning going on, it simply means the material has been broken down into very, very, very simpler or finer particles. So what you are doing is, as you are burning, imagine you see, when you start that burning process, initially you can see a lot of smoke. In fact, some look as white as something.
Yeah.
A lot of smoke, and gradually it thins out. What's happening is that the accumulation of the substance or the particles is higher when the combustion is initial.
Doc, before you go on, our viewers are a little agitated. Most of them are like, Doctor, no, cancer me entasi. Inti yanka infante ana also be kan santi tree so a ana wetu aka tree kakra mai
blend it
o be blend e na blend enu be boa ye mpa if say asem a wo kan hu hia me ka se ye mfa mra fie e be say e ko china fie ne ye ba fie ne ye tie no mo be ne ye ni fie a e ma ya ahrawa no e hu ka wa sha se wo se kwan e fa so ye soja mpo rubber tuntun paper ne sa no ma na ya e di soja no wo se e ha ye mbebre na wo chirechirim ti chire no mu ma ye kakra
nti sa ne ma no wo se wo hia o shi niama no na ugina nchen bi wo wa ugina nchen wo be humi se o humi nso asa niama we utimi breathing in o humi ko mu na se ko mu a some of these things might deposit, but at the end say enye te say wo ye nde ya no we hu sunsuzu aso. It has to be a prolonged period. Even smoking over a long period would cause what they call the COPD, or the chronic obstructive pulmonary disease. It has to be over a certain
exposure
period
for prolonged.
Right.
Yeah.
It is anyama we enye say mechanic teacher say ene ya we ya na o lungs are starting say enye sa net.
But women in kakra over the years no. We say no betumi akofa o hawa.
Sa pepepe. Intia na nkofo bi de initiative by SSC anu nanka se be ya yenjai eja ye so mponi use gas.
Gas nso na ne boy de say.
Yenja is open. Yensha to say issue guys because of some of these issues that we can be at risk.
Any 1 year waka benku choba fo so bi o ha edija na de aka so ani na ogina ho na waka benku na nwusie na ekọ nani na o yes wo se wo yes for so many years
obetumi nya side effects because they be say oh ye na say oh home sa nyama we ko mu na say deposit in sa SX ya kan every time over a long period like why is that dey be 10 years omo yes no o say edru baby a omo ntimi enje ahomiye omo ntimi nhumiye ensisi so ndi o hwe obi to say the your friend bibi secondary smoking ana obi a ono no enye say o hye cigarette ana bibi enso ngofo o hye na ogina ho
otantina baby a smokers ewo pa
sa pepe na akoye nti sa nyama na nipa no smoking release no any smoke na cigarette na o hye na burn no se na u inhale sa nyama na betimi ama issue no sa pepe na o yes sa nyama we ete
enti ye wo fiara me ka enoma hash ya de paper form mosquito coil ni naphthalene balls na de ni eno so nkomo kakra
nti sa nyama we most often no respiratory issues
okay
na it's not always going to cause a lung issue
okay
but respiratory tract ni it says na kind or trachea all the way to the bronchus and all of those things but one can say ubie even say power zone so a she na echo umu like the effect say na e affect you no sanyama we nyina ye the chemicals na ye nti ade ne say ye ntimi njai completely nanso oh yeah na wa hwe ho so ye na we reduce say every time eno na wo koso ye
all right yem hwe entintan broni fe bibi molds obi o ha ohunu sa say no ma bi epiepie ne wall ho o ze baby o ha say wall no wa penti o be na say ase nsuo bi obi kura na nsuo na wo ho any efin kitinkiti aya na chiche ye fie ni ade no eno nso betumi ahaye ana
eno so de ohauba ye wo nkofo bi wo ha omo ne ye friend no allergy na nkofo bi wo allergy to adiabro ni friend no aspergillus fumigatus a type of mold nisania mawi na obi a owo allergy to some of these things no say o inhale some sort of allergic reactions and all of those things nti ne emeka treatifo ni nyina ne say ohun say bibi ti say sa e ba wo dem a say o pese wo yimfi ho kra the kind protect wo ho do pa nose mask say o pese wo yi cobwebs ne sa nyama we nyina nose mask
entin
time
obi entin time woni dem o pese oyi no ogina ase no
me hu ne o chere do make sure so be share nose mask just say na be ya onhu me nyama bia enye e won environment ni mu nko mu.
All right, so yeah, di eno hu nkomo ye di fie nkomo yemra mo amowo labs eno ma bi say obi o ha wa lab adwuma be ye 15-20 years they be all the chemicals ni ade ye adwuma woni ye say adwuma no onso obetumi enya lung issues emra na wanyini
sa ne nyama ni nyina ne say chemicals nye nyama nka e was ekwe body mu nanzo akoye say ehu hia ema adwuma bebre ayedi uba lab mo a ye obi be friend no safety protocols na safety protocols we e wo ho se na be ye be boni pa na o ye adwuma wo lab ne ho ban ye nim se sa nyama we betimi ama wo how ntia no mo de safety protocols ema ye nyina ye di so se na be ya ye nkonya issues afterwards chemicals bi wa use wo lab a ebe hardwin nti sa chemicals ni nyina no lab bia wo requirement say ube kire omo ye adwuma wo ho se ube yisu sadie we ya enwo se oye ni say e wo se oye ni say nti ye nyama your friend say safety chamber and all of those things nti say oye adwuma na say ne wo yisu na ya de anka ohumi ebe hawa some labs would recommend that you wear nose masks. Other times you have to work in a safety chamber the safety chamber na say o separate at the chronic free wo the ebia na won sape ene hyem ne sa ade no na sa fumes no would have to go out in a different way se na be ya nipa no ye djuma wa lab ho no onye affected.
Okay, yamra chronic diseases are ebetumi affect your lungs say ama ye ni ankowa
Inti chronic disease ebetumi affect your lungs no Mamin started with something like someone who has allergy, and some allergies to some extent are not, you can't get rid of them completely. Inti say ebia when we say me wa allergy be wa is as a result of things that you inhale. Inti say when we say ebia me who say debia se me ba ne fan say pillow we mpo se me ma me ba ne da pillow we so a bona edro ahomachia na najo a untimi humi ye. So the first thing you need to do is anytime you realize something is not going well with your health, seek medical attention.
Okay.
And sana obeba fie abeye ni afie fo be chere say oh that no me ba ni ye stay kra me ye say no ekoye no kona ko hu doctor hu doctor na onansa na betimi a chere say ebia yenye lab we na yenhwe say e dey important na ma unya sa issues we. Inti usually say unya chronic issues like constant allergic reactions nisa nyama we are. The decision lies on your caregiver or the healthcare practitioner. Ono betimi actually say condition way e betimi affect way inti o say ye ni say. Me kan ko si say improbably no say sanyama we si a na obi hu say wenya issues ze ontimi nhumi ya yetie de ngofo kan wo fia ansa yaba hospital. And sometimes before you get to the hospital things have gone worse. Na ehono yentimi shedant boaoza na I was there who say sa lungs we say na me chemu ye shas ye no you can't do without them until you have to give them the maximum attention they deserve.
All right, so let's look at some sort of autoimmune sicknesses and non so betumi ha lungs no.
So autoimmune diseases usually, if I'm to explain what they are, is when your body is supposed to see something as normal, but now your body is seeing it as foreign.
Okay.
So auto simply means self. Autoimmune, it means you are immune to your own self. Now you are trying to produce some things that will affect your own body. So there are some people that have some chronic autoimmune diseases, as you mentioned, which can affect their lungs. But as I said, all of these things cannot be said without seeing a medical person.
Let's look at recreational drug use. One year, Nancy, yeah, I mean, because one day I na craboni bi, or to Max TV who know or some means koye bi and she, but then it do up there was here. Can you say, ye, you know, money be in maybe, yes, super glue. Na omu de Johnny adie no mu ye bi kra ye say balloon na omu de ha yen hwe sa no ma no ene nia eye ekutia ya rawa no
Mamemfa the abe common pa say this is not to destroy any business, but young people that have indulged into shisha because they feel it's not too much of smoking, it's flavored, it's nice, so you are enjoying it. I read a research paper that says that if you use 30 to 45 minutes of your time on shisha, it's almost about using 100 cigarette sticks.
Yes.
Now, all these effects we mentioned that someone with cigarettes is going to have over time. What's NASA the 45 minutes? You use 100 sticks of cigarettes. Before you know it, you are having issues. Now, it's mainly in the youth, and the nation is putting their trust in these young ones. So the effect is not only on you as the individual, but it escalates to affecting Ghana as a whole. Let me come back to some of these things that you are talking about. You see, as I mentioned, omo use cigarettes, for instance, no. The omo person beja ni a good feeling from nicotine, no. Inti, we say recently balloon. na umehu balloon na from Monday few mobile. Now these balloons are also made with chemicals.
Yeah.
Some of these chemicals give that pleasure that you experience in your mind.
And vaping as well, as we can see
right.
there. It's flavored, it's nice, and whatever. By the time I'll be na ama wahrawa nyina ahye.
Intimi say no cry.
Intimi say no cry.
Yeah. So these things that you think are normal, oh, it's not cigarettes that I'm taking in and all of those things. The first thing you have to ask yourself is, what is this vapor items actually giving me to take in? Anything that is not food that goes into the body has an effect on you.
Ade bia nya aduane anase nsuo. Some people add water to it. Ade bia nya aduane anase nsuo ekọ honam ni mu a e was side effect. Ebi e mild, ebi e severe.
Ebi wo okra unhunu sisi a etre that bi anka wenya osika opese odi ni yie no. Na waba no akasa na doctors no no monye.
Ho.
That is ya menya ska omusi memenye se. Refi se langa wo yakola no na wo ye niam bia ense na enfata. Ni krakra nyina ne se wo se nyina ye hu se ye lungs no ehu hia pa nti ye mbo ho ban.
Eno ene ma honam ne mframa ese yi carbon dioxide there where you carbon dioxide meaning ni tree nka oxygen kwa meaning ni tree. Na doctor hano Ghana hano lung disease ben pa na ya muten hu mu treat lung disease ben pa na wo Ghana ha pa.
So usually mami research, the last research in 2020 estimated that 1.78% of deaths in Ghana is actually as a result of lung damage. And if a ranking was done in the world, Ghana was going to be 69.
What?
Yes.
If we are seeing senka ye kire omanya ahrawa yare anasa ahrawa say ewompa nka eduasia enkron. Yes, 69.
Yes, 69.
If we are seeing Ghana also.
That was as at 2020.
Wow.
So that's just like 4 years back. So we can imagine probably the number has shot up by now if a new research is
because of the shisha, now vaping and smoke, cigarettes, weed and all of that. So how do you treat, how can lung, let me even put it right. When someone's lungs are damaged, can it be reversed?
That's the problem. Lung damage is not, I should say, the degree of the damage is what determines what can be done to help you. So in the initial stages, if for instance, constant smoking is what is causing the issue, and the effects of these things go beyond just your lung, like I was mentioning earlier. So the body now is no longer stronger to even help in your recovery.
Yeah.
So it becomes difficult for a totally damaged, like you would see on screens, those very dark lungs. It's not an animation. If you should go into a branch of medicine like histopathology and all of those things.
Okay, so as you can see there.
Yes. These things are not animations.
These are real.
Yes. There are people that do autopsy and you would they find some of these things as the cause of their death because the lung has been damaged beyond repairs.
Yes. And it's all because it's smokers for so you are saying say baby rawana say akodru no be kire mo a mo betumi edi aboa se wo ba na se ni nyina say ya na se ni nyina say so na se wunya mframa o.
So usually those people, they have to help them with oxygen and all of those things. But how long can you be on that?
For yani Dr. Edin Komo afa yahrawa ho yedin komo na baby ehu hia me pa ani fie die no o say eja yeso aya ede rubber so no obi beka sa doctor pa me sha se ede rubber so ja enye ne o say arehusam e wo ho ne say na utumi koba wo hu no wanyina dru baby kakra no ho na obehu nsunsuanso bone no afa wo bekọ no ne aka kiro se bia wahrawa no damage bia bam and I say ni say because say me a me num cigarette me a me num nsa nkofo hihye ma num bi enti ye den na mahraba ye say o si jana ye so no rubber no eno nso ka ho na o ka se wo titintinta na se hu se molds bi aba wo ho a o si pentem na ye hu bi bu titintinta o si hye max enyina se entete enwu so mosoto coil ni sa normal no na mpese ye di ngo bi si ebetumi akose lung damage but wo ka se normal respiratory infections and wo home dru benu ebetumi ohaw ebetumi abamu o kan so se ebedu ba bi na roofing sheet ya tetede no won wo di bofo mo ana abo no ni ye ka se won ye no won ye manufacture chemicals bi a wo de ye no eno betumi ama se wo twuko mu a edru ba bi a ebetumi ama wanya lung infection and acid damage or san kan so say lab for baby or why say control chamber say bibisa or say you have to follow the protocol and say we dey me nya ne kwakwa na me nya so be hunu kakra ka bedu baby no na damage ba dey ba ko kan ya me yam hye me pa ne say yes say car no okọ na neto no ya pru na wusie ni basa wugina mu a obi ho ye say o say o yes ha o nya hwe o say instead say oxygen ebeko mu no afi o say carbon monoxide eno na ekọ honam ni mu enti na che say driver say take car mu or a driver for over 20 years they bia ne car to onwusie woni e ton ade wo kwan ho woni e wo stations ahodo a e fa sa no manimu nyina no over time after they've been healed for some time no betumi anya ho nsunsu so na say mo kan ne say enye achi ne wadwumbe say bia you are safe because ene nhunu hwe na o say wanyini no waduru baabi no afei na yi ne ho na oye ho hwe a enye ye na o say nhunu bibi ti say allergy ewa bi a wonti ase ehumi bi ensisi so enfantena fie ne ntietie nkofo asem fakọ hospital na choda na bia is more serious than you think o say wo de call entemo a ebetumi asia no ama so wo asem busa bia 0558462088 obetumi afre doctor wa ha na one no edi nkomo enso so wo pese woni edi nsawo so wo abefo tentan kase ene so na eno ani Facebook Max TV on Facebook Max TV on Facebook and I think so person send you WhatsApp 0558462088 na doctor what have we missed ebiana bibi da wakoma so person oni edi nkomo efa lungs ho ebia mi musai
I think I didn't mention the symptoms that we should quickly rush to the hospital nti ebine say ebiana ubowa na mujawum ana you've gotten chronic coughs nti ubowa 2 weeks enko 3 weeks enko
doctors ya muka say what bia edi 2 weeks bia is abnormal
that's a big problem because
what is about 2 weeks na enko ya especially say what fedro na say still enko what say abnormal
yeah you should in fact immediately after you have taken some cough mixtures 1 week 2 weeks and it's still not going seek medical attention.
All right, Christabel Ufrefi Bubuashi, good morning. Christabel, wadauma enti hu wa TV no so why? Yanka samfa phone mu nya sai come on the best style bi. Good morning, Kasa.
Yes. The madam Patricia, there Michelle last time say me allergic to spray and this spray when I make tea like me I just said me I'm in the sea and I make call hospital now so doctor nation ne do trauma me call from my send me kwa kono I run medicine on the demand
idea medicine
and so
what's the idea medicine
no trauma me say doctor and demand say me no ne de boa me say me to me who me you wrong medicine.
How did you know say wrong medicine? Pharmacist no catch there one na say.
Pharmacist no catch there say. They do not make ya trauma many day different.
Wow. Well, I don't know once uncle because pharmacists are not doctors, although omuni madromu. But sometimes doctors give you certain medications for some call away a lab. I say doctor natural man or the pharmacist may say wrong medicine. So in this case, She should have gone back to the
Yes, see, that's the best. You should have gone back to the doctor, and if possible, get a contact of whoever the pharmacist was. Then, when you go to the doctor and explain to the doctor, if there is a need for the doctor to communicate directly with the pharmacist, they do that. You know, I just want to use this opportunity to advocate and help people understand that healthcare delivery is a connected system.
It is. Let that me catch you. Oh,
Mate.
I need to pick a call and come back. Okay. Hello. Good morning.
Hello, good morning.
Mami Kasa.
Dr. Kweshidakra.
Okay, go ahead.
Pacho, for 9 years ago, but Nipo was see Mr. Yenia, and see me the Nipo pharmacy and my woman is wrong. They are worried and yet school, and I'm in the hospital. Hospital, do not put your palm and let me be right. I quite said there's a journal passing the every month. And see, Michelle, if I say no, I'm not starting the hospital. I'm also more concerned when I'm starting the staff. I know, or you see, or Bob, what you need to say now, but you need to say, I'm only the new form for share. Some man, I know a different one here. Pharmacy, stress hospital over the man.
Now, Mammy, maybe so.
No one says to share.
Maybe so. Obano or Yaria for Frobi. Or Yaria for Frobi, Anna. Or Bibi or Yaria for Frobi to say sickle cell, Anna Bibisa.
Okay.
Obano Yaria for Frobi one in home, and I one in Kwan Obo.
A one man noble.
Okay. Yeah, that's it.
And say, Papa didn't call a different hospital.
All right.
Okay.
Yeah, that's it. Yeah, that's it. Doctor Beyiwano. On the sickle cell, for sometimes they get acute chest syndromes, which can be like that. They can cough, you know, and it's so loud. Mommy, yeah, that's it. And I think the first two callers have the same issue. Why they say wrong medication? I don't get it.
So I was saying that healthcare system is connected. No one, especially a patient cannot say that the doctor gave me a wrong medicine. The notion comes from usually when they go to purchase a drug, and in purchasing the drug, the pharmacists can find out that, okay, why are you buying this drug? Because that's their duty. Do you have a prescription? And they are able to tell that, okay, for one or two reasons, I don't think this particular drug is okay with you. Remember I mentioned that it's supposed to be a connected system. So the next thing is to get in touch with whoever prescribed the drug. Now, what we see in our setting usually is a little disconnected kind of system. So, Nipano te Bubuashi, for instance, the person has gone to Kolebu and leaves Kolebu with a prescription, comes to Bubuashi, came to the pharmacy, and when he was purchasing it, the pharmacist determines that something is not okay. As a pharmacist, what you have to do is to let the person go back to the doctor. If possible, give your contact to the lady. Let the lady send it back to the doctor, and let there be that reconciliation.
Okay.
Right.
Let's pick our next caller. Hello, good morning.
Good morning.
Papa Kasa, doctor.
Papa, our phone, Dr. Mano, Brahman, I'm going to drone. I'm going to drone. Somebody a Brahman. I'm an alpha. I'm a professional one yet, and they wrong.
Wow, this is not connected to what we're talking about at all. But Papa Wadama, we are there who say a drone or the man no and a sabi ama unana ye free mu. How are you so sure?
Say call the back no. And I present the back no. I know the drone children na so no anya we na me trauma am. The me trauma am here. And I so for doctor for the man say we see do the same thing.
Me ba cho doctor no na obusa sa.
What does it?
Doctor no na obusa ne say drobe na ofa anya we na me trauma. Enti bacho doctor no o kan si so say eye droning ti na ama abofra na wu. Oh, too bad. Because to me kind of trust we need to ask further questions. We can probe further.
That's right.
To understand, because so many things can contribute to the fetus aborting. Senior doctors or something like that. High BP, pre-eclampsia, you know. And sometimes I thought that herbal preparations be IFA, and I said overdose of certain medications. Any idea? And I thought that cry, so I would no cry. This is so many things.
A lot of possibilities.
A lot of possibilities. And so yeah, to me, you know, so say doctor no and can say a draw way I will find here when the fetus came out. Yeah, call lab. Actually, say maybe a fetus nimu a draw way. Oh, yeah, to me, it's not TV so and casa. So let's be careful. All right, good morning. Hello, good morning.
Hello.
Hi, Mami Casa.
But your friend here, if we had to.
Doctor.
Doctor said, he said, it me that machine me that a lunch never normal.
All right, thank you, Dr. Betty.
So, what's it say? Oshina so jaya. Okay. The sana make kind, no. It depends on how long you've been smoking. Osha says the ocean, it didn't fear na ujai enso no as at the time a ujai no na wo lungs na etesen nti yesha said make say uba hospital na say doctor bia sure na any medical doctor is attending to you they have to assess what issue they have to assess say asem ne koduru sen ana lungs no e ho to chima ekosi sen
but we can maybe say so ujaya the lungs can regenerate and rebuild into me by no way no comfort line so hello good morning comfort.
Hello.
Good morning dear doctor.
Good morning.
Mbacho kasa.
Me pacho na me ba yare na me ko hospital. Enti doctor no program my ye kwaje ya ye ko na tini ho no. But ni shodo na say doctor na tro and I'm saying nti wan fe be na ma boko. Doctor no ho ko do football. No the break. Nti me bisa say chef ebe how you now.
All right. Yeah, that's it. Comfort. I think we might have to do a whole show on prescription and wrong diagnosis and all of that. Yani Dr. Bedin Komo. Now, yeah, we will do another one. Say, yeah, Shamobo. I'm say Tuesday when Yanko ya Duma. We do because a lot of our callers seem to be having issues with that. It's not as if this does not happen. I read some confidential documents. Me more hospital needing. Niame can say there was a medical officer there who was on drugs. Who the medical officer who was on drugs. And anytime obey high sano, any sabi or kikan, a yibo musa, minka sabe be a misremo. It was a confidential document. Hey, to Miss Remo, near one in answer, near answer wrong. And ye can was him. Hello, good morning, Gloria. Ofe fiama sama.
Bacha,
Casa.
me pacho, me problem is there. Say me water e mi no te bia audio bi wo bi ampi anate bia I am take fine pena me manya sport it we don't talk to man na ta te before
Me pacho o question ni bio mami pacho nya bu tre
the other point of it on amount different things no see
mami wadama
we no mo
nya bu tre doctor say want to first question ni ye o si say kan obi anu ma
me pacho yo me pacho yo we me pacho me see me what problem on me good say bia we pop be na audio we do something that after the bia anu ye tin a o do mo say na me nya so na me master tenu sa na bi ko mana e di wa me po na to me shaman you know say to what you na me fear bia na ko to to ni pe ko pe we do particular dey collect people na me go get se na o jai the doctor pe And you said,
I mean, what's some with you? I said, Max TV novella, yeah, you are. Too good to be true. A rabbin will try to be who tennis in a way you pay not you. Hey, I say, okay, so Matilda. So be a strong. In fact, maybe an any roll on an perfume. Same 50 cent crowd will be one. Or tina nipa ni nkyɛn a no wa hyase ni hwene keka na ni mini keka and those things.
Usually when people have itches and all of those things as exposure of something they've inhaled, then you are looking at the body reacting usually in the allergic area.
Yeah.
So if I'm allergic to something, you realize that immediately you start feeling itch.
Yeah.
It's because some allergies will lead to the release of a substance we call histamine.
Yeah.
And this histamine would cause those itch and all of those things.
Okay.
Right? It's better to get to know what exactly you are allergic to.
Let's pick our next caller and we'll be back. Christy, good morning.
Good morning.
Doctor.
Never said me who say the use of air refreshness and this will be effects your lungs and secondly so ice water and so effects on your lungs so
Thank you so much, Chrissy. Excellent question.
Thank you.
Air freshness.
Yeah,
they
so
spray cream. In fact, you have mosquito spray. These are no money in any ice water.
Right. So I think this one is home.
Home.
These things are done in the house. So let me start with water. In fact, as I sit here, I'm yet to discover a research work that says that drinking cold water has effect on your lungs itself. Yes. So I haven't seen a clear correlation. It could cause other things, probably, especially if you have cold or flu. When you have cold or flu and you take cold water, it could worsen some of these things. Yes. Back to air freshness and mosquito coil and all of those things. Now you see, these things all have ingredients in them. So it's always advisable first to check what the package is saying, which most people don't do.
Ghana 99.
Which most people don't do.
Check the package.
Right. It would amaze you. I came across one air freshener. It's supposed to be an air freshener, but the instruction on it is that when you spray the room, exit the room just like the way a mosquito coil was. But I'm like, but it's supposed to make my room nicer, so why would exiting cause an issue? Wow. And it's actually because in the moment you spray, the concentration at that time could cause issues to you. It might not necessarily cause a damage to the liver, but in your respiratory tract, you can start having some issues.
Okay, so we're going to pick our last caller. I'll be back to you, doctor. Hello, good morning.
Hello, good morning.
Sorry, someone more Gina Swatch. Why? Me talk asa.
Me bajo, me pasa, me bisa doctor say. If you see a woman, me a mini, menti cent, sabi a bon pa menti. Because me bisa say, eno area.
Okay.
Okay. So let me just answer that. The senses are controlled by our brain. So your ability to touch, say obiti me, they won't say can be able to say ayeshe. Say obiti me, here be able to say we ye him.
And I say sabi bon.
And I say obiti me who are dear crano. Bibia na wadring so. Now there are portions of the brain are responsible for these things that we do. Inti, if you are unable to perceive something, and who say bibi ehwam and say bibi bonwa, the first thing, as I would say, is seek medical attention so that the issue can be investigated. Na say mbobi wo ho metimi dia boa wa o dia boa won tem.
Minimobi or what that issue or bibi crash here or yeah aduane na bibi here or they call hospital mama check here, they couldn't find anything. The only thing is be careful. Because now you can be asthma and those things. Asthma, your last question, if unchecked, can it cause lung damage?
Yeah, it's so you have to understand how asthma actually works. Okay, people that are asthmatic, usually you would see them having some of the symptoms like tightened chest, some wheezing sounds, and all of those things. Now, remember that all these things are supported, or the base of it is your lungs.
Yeah.
Okay. Now, if your lungs are struggling over time, if your lungs are overworking. It's just like every other tissue. With time, they might lose their ability to be flexible. They might lose their ability to support you in all of these things. So it's best that if you have an asthmatic issue, which usually might even be chronic, you need to seek medical attention and follow any laid down guides to help you not get extreme issues like a very severe impact on your lungs.
Okay. So, anopai yede aseda pa kesiye pa. Emema Dr. Emele Arthur-Hayford. Come here if you last time. Dr. Edasi P said no ababe kai. Obi audinti abe mana ansa no wako because yebre naso.
Right. I would first of all want to say a very big thank you to my LinkedIn community.
Okay.
The Health Commanders team. Basically, the plan is that we help people take command of their health.
Okay.
So I want to appreciate them all for their support and kindness. Then I want to also appreciate my colleagues that I do this advocacy work with.
Okay. So Dr. Emele Arthur-Hayford, or your diagnostic scientist, Anna?
Yeah.
And he said, Nana, or a doctor Mupa. Where do you work?
So I work with Omni Diagnostics.
Omni Diagnostics. All right. Ebusian for your brano aso near the Healthy Tuesday. It's Unyankopon Yaduma. Kuya da ochina ebe sa betena say the Max Morning Show no abeso.